My name's Raquel and I'm from Jersey City. I've always wanted fuller lips, and my lips are a little uneven, so I'm hoping that they'll be more even and fuller. Dr. Salter-Lewis came highly recommended from a friend of mine.
Restylane Silk is a hyaluronic acid, and it's actually one of the newer products that we have available now. First there was Restylane, and now there's Restylane Silk. And Restylane Silk was made for those folks who might want their lips done for enhancement, as well as their lip lines if they need to get done. And sometimes when people get their lips done, they think that they're too big or too full. So now we have Restylane Silk, which actually helps with a happy medium with how full the lips are, so it's not so overwhelming. So today we have Raquel, and she's getting her lips done. There are three things that I pay attention to. One, what is the asymmetry that they have with their lips, or the symmetry? Most of us, probably 99.9% of us, we have lips that are asymmetric. I like to note the asymmetry because one of the things that I like to do with the filler is correct the asymmetry. The second thing that I look at is the contour of the lip. Actually, the natural contour of the lip. That's a mistake that sometimes injectors or physicians make, in that we try to make a unnatural contour, or someone brings you a picture and says, I want my lips like those. But if it doesn't fit their natural contour of their lip, then it looks fake, and we don't want that. We want the patient to walk out with the fuller lips, more defined lips, but very natural looking lips. And that happens as long as you follow the natural contour of her own lips. The thing that I look at, or the thing that I try to make sure that I pay close attention to, is what's called duck lips. Now, those of you who've had your lips done before, or those of you who have seen other people with their lips done, and you know that they have filler. Why? Because they look like a duck. And in order to prevent that duck look, there actually is a certain way, or a technique, that you have to use in order to prevent that. So what I like to use in my patients is a particular type of technique that pretty much 100% of the time I can prevent that duck looking appearance. And that's very nice, and the patients really, really appreciate that. And that all has to do with the technique and the expertise of the physician that is doing the actual injection. So now we're gonna get started with Raquel. How you doing?
I'm good.
You're good? I'm great, I'm great. Okay, so listen, we're going to remove your numbing cream, and then we'll just get started. One of the things I like to do while I'm injecting as well is I like to look at the proportion of the upper lip and the bottom lip. Typically what we want, in order for it to look more natural, is we want the bottom lip to be either bigger than the upper lip or the same size. If you have an upper lip that's bigger than your lower lip, then that's when it looks unnatural. I also like to do what's called a Cupid's bow, and I like to accent that because that's the little heart shape that's at the top of your lip, and it gives a real nice definition. And then I like to go along the border of the lips. And that way your lip liner and looks really good, and your lipstick stays on. All right, take a look.
Oh wow, I love them.
Thank you so much for joining us. I'm Dr. Cynthia Salter-Lewis, and I look forward to seeing you again.